Welcome to our channel. Today we're diving into the world of abscesses. You know, those painful, pus-filled bumps that can pop up in the most inconvenient places. What are they exactly? Why do they happen? And most importantly, how can we get rid of them? An abscess is basically a collection of pus that forms within your body's tissues. Think of it like a little battleground where your immune system is fighting off an infection. Pretty cool, right? But also, ouch. Stay tuned as we break down everything you need to know about abscesses, from the different types to the symptoms and treatments. Let's get to it. Now, let's dive into a specific type of abscess that can be particularly concerning: the intra-abdominal abscess. This condition is not only painful but can also be life-threatening if not treated promptly. As the name suggests, this type of abscess forms within the abdomen, and it can be tricky to spot. The abdominal cavity is a complex area filled with various organs, making it a prime location for such hidden dangers. Intra-abdominal abscesses often develop as a complication of surgery, appendicitis, or inflammatory bowel disease like Crohn's disease. These conditions can create an environment where bacteria thrive, leading to the formation of an abscess. Imagine you've just had surgery, you're recovering, and then bam, you develop this painful complication. It's a scenario that can catch anyone off guard, adding stress and discomfort to an already challenging recovery process. Symptoms can be subtle, including fever, abdominal pain, nausea, and vomiting. These symptoms might seem like typical post-surgery issues, but they can also be indicators of something more serious. Sounds familiar? Well, it's important to remember that these symptoms can also indicate other conditions, so it's crucial to see a doctor for an accurate diagnosis. Ignoring these signs can lead to severe complications, including sepsis, which is a life-threatening response to infection. Diagnosing an intra-abdominal abscess usually involves a physical exam, imaging tests like CT scans or ultrasounds, and sometimes even blood tests. These diagnostic tools are essential for identifying the exact location and size of the abscess. These tests help pinpoint the location and extent of the abscess. Accurate diagnosis is the first step towards effective treatment, ensuring that the medical team can plan the best course of action. Treatment typically involves a combination of antibiotics to target the infection and a procedure to drain the pus. Antibiotics alone may not be sufficient, as the abscess needs to be physically drained to remove the source of infection. Draining the abscess can involve a needle aspiration, where a needle is inserted to draw out the pus, or a more invasive surgical procedure. The choice of method depends on the abscess's size, location, and the patient's overall health. Remember, early detection and treatment are key to preventing serious complications from intra-abdominal abscesses. Regular follow-ups and monitoring are essential, especially if you've had recent surgery or suffer from conditions like Crohn's disease. Staying vigilant can make all the difference in ensuring a smooth recovery and maintaining your overall health. Let's move on to a more relatable type of abscess: the dreaded dental abscess. This is something many of us have either experienced personally or know someone who has. It's a common issue, but that doesn't make it any less serious. We've all been there, right? That throbbing toothache that just won't quit. It starts as a minor annoyance but can quickly escalate into something much more severe. A dental abscess is a pocket of pus that forms in the teeth or gums, usually as a result of a bacterial infection. This infection can stem from untreated cavities, gum disease, or even a cracked tooth that allows bacteria to enter. You see, when we don't take good care of our teeth, bacteria can build up, leading to cavities, gum disease, and eventually those painful abscesses. It's a chain reaction that starts with neglecting oral hygiene. Symptoms of a dental abscess are hard to miss: severe tooth pain that can radiate to your jaw, neck, or ear, sensitivity to hot and cold, making it difficult to enjoy your favorite foods and drinks, swelling in the gums or face, which can be quite alarming and uncomfortable, and even a foul taste in your mouth. Not a pleasant experience. This bad taste is often due to the pus draining from the abscess.
If you're experiencing these symptoms, don't wait. Ignoring them can lead to more severe health issues. See your dentist right away. Early intervention can prevent complications and save you from a lot of pain and discomfort. Delaying treatment can lead to the infection spreading to other parts of your jaw or even your bloodstream, which can have serious consequences. In rare cases, it can even become life-threatening. Treatment for a dental abscess typically involves draining the pus and getting rid of the source of the infection. This is crucial to prevent the infection from returning. This might involve a root canal, antibiotics to clear the infection, or in some cases, extraction of the affected tooth. While this might sound daunting, it's often the best way to ensure the infection is fully eradicated. Remember, prevention is key when it comes to dental abscesses. Brush and floss regularly to keep your teeth and gums healthy. See your dentist for regular checkups and cleanings, which can catch potential issues before they become serious, and address any dental issues promptly. Taking these steps can save you from the pain and complications of a dental abscess, so don't ignore that toothache.
Now, let's talk about pelvic abscesses, which can be particularly concerning for women. These abscesses are not only painful, but can also lead to serious health complications if not treated promptly.
A pelvic abscess is a collection of pus that forms in the pelvic area, which is the lower part of the abdomen below your belly button. This pus-filled pocket can cause significant discomfort and may lead to further complications if left untreated. Several factors can contribute to pelvic abscesses, including sexually transmitted infections, complications from gynecological procedures, or even ruptured appendicitis. Infections like gonorrhea and chlamydia are common culprits, as they can spread to the pelvic area if not treated properly.
It's important to remember that pelvic abscesses can affect anyone, but they're more common in women. This is due to the anatomical structure of the female pelvis, which makes it more susceptible to infections that can lead to abscess formation. Symptoms of a pelvic abscess can be vague and easily mistaken for other conditions. This can make diagnosis challenging, as the symptoms often overlap with other common pelvic issues.
You might experience lower abdominal pain, fever, chills, vaginal discharge, or pain during intercourse. These symptoms can vary in intensity and may come and go, making it difficult to pinpoint the exact cause without medical intervention. If you're experiencing any of these symptoms, it's essential to see a doctor to rule out a pelvic abscess. Early diagnosis and treatment are crucial to prevent the abscess from worsening and causing more severe health issues.
Diagnosing a pelvic abscess typically involves a pelvic exam, imaging tests like ultrasounds or CT scans, and sometimes even a laparoscopy, which is a minimally invasive surgical procedure that allows the doctor to visualize the inside of your pelvis. These diagnostic tools help the doctor determine the size, location, and severity of the abscess.
Treatment for a pelvic abscess usually involves a combination of antibiotics and drainage. Antibiotics are essential to fight the underlying infection, while drainage helps remove the pus and reduce pressure in the pelvic area. Drainage can be done through a needle aspiration or a surgical procedure depending on the size and location of the abscess. Needle aspiration is less invasive and can be done under local anesthesia, while surgical drainage may be necessary for larger or more complex abscesses. In some cases, a combination of both methods may be used to ensure complete removal of the abscess. Recovery from a pelvic abscess can take time, and it's important to follow your doctor's instructions carefully. This may include taking prescribed medications, attending follow-up appointments, and monitoring for any signs of recurrence. With proper treatment and care, most people recover fully and can return to their normal activities. Remember, early detection and treatment are key to managing pelvic abscesses effectively. If you experience any symptoms or have concerns about your pelvic health, don't hesitate to seek medical advice. Taking proactive steps can help ensure a swift recovery and prevent future complications.
We've covered some of the most common types of abscesses, but it's important to remember that they can occur almost anywhere in the body. Skin abscesses, for example, are incredibly common and often result from a minor cut or injury that gets infected. Symptoms of a skin abscess are usually pretty obvious: a painful red swollen bump filled with pus. You might also have a fever or feel generally unwell. Treatment for skin abscesses usually involves draining the pus and keeping the area clean. Your doctor might also prescribe antibiotics if the infection is severe, or if you have a weakened immune system. No matter what type of abscess you have, the general approach to treatment is the same: control the infection and drain the pus. Antibiotics are usually the first line of defense against the infection, while drainage can be done through various methods depending on the location and size of the abscess. Remember, early detection and treatment are crucial for preventing complications from abscesses. If you suspect you might have an abscess, don't hesitate to seek medical attention. Thanks for watching. We've covered a lot of ground today, from the depths of intra-abdominal abscesses to the familiar discomfort of a toothache. Remember, abscesses can be painful and even dangerous, but with the right knowledge and prompt medical attention, you can overcome them. If you found this video helpful, don't forget to like, comment, and subscribe for more health tips and information. Your health is your wealth, so stay informed and stay proactive. See you next time.